through this study, we wanted to reevaluate the importance and potential possibility of family history, which is one of the most basic components of medical history. Hi, everyone. This is Professor Hirohito Sone from Niigata University, Japan. I'd like to just introduce our latest paper, of which title is Cross-Sectional and Longitudinal Associations Between Family History of Type 2 Diabetes Mellitus, Hypertension, and Dyslipidemia, and their prevalence and incidence, which is Trannomon Hospital Health Management Study number 24. And it will be appearing in the August issue of Mayo Clinic Proceedings. Now that whole genome sequencing has become commonplace, family history may be one of the most overlooked items. However, the results of this study show that as long as detailed interviews are conducted, a classic family history can actually show clinical usefulness that is comparable to or even surpasses the latest polygenic risk score, maybe because it includes not only genetic scores, but also family lifestyles, and it can be done at no cost. What we did was to examine both cross-sectionally and longitudinally the relationship between detailed family history and the three most important non-communicable diseases, which are type 2 diabetes, hypertension, and dyslipidemia, using a database of 40,000 health screening participants. Family history was obtained by questionnaire regarding 3 generations of parents, siblings, and grandparents, with how many of these people were affected. The results show that for all 3 diseases, people with any of family history of the 3 diseases had a 2 to 3 times higher prevalence risk than those without, with the effect being strongest for type 2 diabetes, followed by dyslipidemia and hypertension. For all 3 diseases, the higher the number of affected relatives, the higher the prevalence risk. But this tendency was particularly pronounced for type 2 diabetes than for other 2 diseases. For type 2 diabetes, the risk was about 6 times higher for 2 relatives compared with 3 times higher for the other 2 diseases, and about 20 times higher for those with a family history of type 2 diabetes spanning 3 generations. Both family history and obesity additively increase the prevalence risk of each disease. In particular, the prevalence risk of hypertension for people with a family history of hypertension and a BMI of 30 or higher was about 19 times higher than that of people with no family history and a normal BMI. But it can be decreased from 19 times to 2 times if the BMI becomes normal. This suggests that for people with both family history and obesity could be able to minimize their overall risk by improving obesity, which is a modifiable risk factor. For overall, it can be reaffirmed that the classic family history is important for still even now. Yeah, thank you for listening. If you're interested in this study, I would really like to invite you to read the whole story in the August issue of Mayo Clinic Proceedings. Thank you again.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.